Students settle into their Monday morning suicidology class, taught by Professor Krall at the University of Illinois Urbana-Champaign. The class fills up every semester it's taught with psychology undergraduates interested in understanding and preventing suicide. However, it's the mental health not of the suicide cults they study, but that of the public university students like themselves that has Americans concerned. Public mental health care facilities on and off campuses have seen drastic cuts in funding across the United States over the last 4 years. According to the Huffington Post, states have collectively cut over $4.3 billion from mental health care since 2009, and at the same time, community health centers are seeing an increasing number of patients walking through their doors. The result is fewer jobs available in centers and patients walking out without getting the care they need. Ex-community therapist Nancy Mitchell says that funding cuts are affecting more than just the community centers, as they are making it harder for graduated students to get licensed.
The funding for those places have been cut severely, especially in the last 5 years. So it's a little bit harder to find right out of school a great setting to get your training in, to get your licensure hours. And some of the settings like the hospitals and the mental health clinics, for example, just don't have as many positions.
Even when adequately funded, community healthcare centers struggle to make a difference in the lives of patients. The centers see, on average, a higher number of impoverished or severely mentally disabled clients than private firms. Illinois undergraduate Bridget McColl says her summer internship with the local community elements was not as rewarding as she anticipated.
I saw the new interns at the beginning of the summer and they were really optimistic and they were like, oh, I want to be a social worker and this is going to be awesome, and they'd start working and they'd realize I can't really help people in the way that I want to. If I want to feel good about my job and good about what I do, I'm going to have to accept that maybe 5% of the people I'm helping are going to make it.
While community health care centers are suffering, mental health care on American college campuses is under its own stress. The New York Times claims that almost half of all students visiting counseling centers are dealing with serious mental illness, a number that has doubled in the last decade. UIUC Counseling Center Dr. Gregory Lambeth says there is a growing number of psychiatric students being admitted.
You go back, 15 years ago, the vast majority of students on any college campus who received accommodations did so for a sensory motor disability, vision, or hearing. And there are now, on our campus and probably many others, the majority of students who receive accommodations are for psychiatric or cognitive disabilities.
While the number of students in need of psychological care is on the rise, on average, campus healthcare center staffs have not grown proportionally with the increase. Students are experiencing longer wait times to meet with counselors. According to the National Alliance on Mental Illness, 40% of students seeking services wait 5 days or more to see a therapist. Dr. Lambeth says that the University of Illinois has moved to a more effective system to deal with the number of students.
They try to interact with every student who calls on the same day that they call. So I think there's a recognition that we need to be having some kind of interaction with students early when they first call rather than waiting for weeks and weeks.
The University of Illinois mental health care system is funded by the healthcare fee that students pay in their tuition. The fee goes to the mental health clinic in McKinley and the counseling center. The two departments collaborate to counsel and prescribe medications to students. One approach to mental health that the university relies on to ensure student well-being is the efforts of trained peers. Vice Chancellor Renee Romano explains how peers are guiding students through school and to the mental health services available.
You may listen to your peers more than you do me at first, and second of all, it gives the peers this great experience. Many peers end up, being counselors or being in some other social work or some other profession.
In the light of the Boston Marathon bombing and the Sandy Hook massacre, Americans are growing more concerned with mental health care, especially for young adults. University of Illinois professor Michael Krall says that a sense of belonging can go a long way with college students.
Having college students feel like they have a sense of belonging, I think, is really important. Isolation is bad for everybody. So students who feel isolated from other students, from their professors, they don't tend to do very well.
Madeline Rose, UI7 News.